Good morning. I'm Dr. Frank McGrogan, a lifetime researcher of Tourette syndrome. Tourette syndrome is a rare but serious neurological disorder associated with repetitive, involuntary tics and urges. According to a national survey in 2007, the estimated prevalence rate of Tourette syndrome is about 3 in 1,000. It affects 3 times as many boys than girls, and it's more likely to affect white children than Black or Hispanic. Tourette syndrome is an inherited disorder, but the exact gene is still unknown. Some research suggests links to autoimmune disorders or even maternal smoking.
Research is limited to the variation and rarity of the disease. Typically, the age of onset is 5 to 7 years, and the peak of severity is 10 to 12 years. It is believed that the tics are not a psychiatric disorder, but rather a neurological problem. Symptoms can disappear in late teens or early adulthood.
Let's talk about the symptoms of Tourette syndrome. First of all, there's tics. They're chronic, repetitive, semi-voluntary, irregular movements and or vocalizations. They can be either motor or phonic. Motor being the movement, phonic being for vocalization. Second, there's urges. They're unpleasant, premonitory sensations. It's kind of like having to sneeze or having something stuck in your throat. And to relieve it, you have to perform the tic.
There are 2 types of tics, simple and complex. For the simple variety, you have eye blinking, head jerking, muscle twitching, sniffing, and grunting. For complex tics, touching objects, clapping, bodily contortions, repetition of words, and profanity are all common signs of this.
Tourette syndrome is often accompanied by attention deficit hyperactivity disorder, or ADHD, obsessive and compulsive disorder, OCD, explosive outbursts, or other chronic tic disorders, CTD.
What could be the best link on how to prevent Tourette's from getting worse? Keep the patient free from illness, stress, and anxiety as these worsen tics. For instance, studies show that Tourette's victims who are bullied in school experience more intense symptoms.
Although many find amusement in the outward symptoms of victims, Tourette syndrome is no laughing matter. Some medications have been found to help alleviate symptoms, but often time is the only cure. By raising the awareness of this serious disorder, we hope to increase the respect due to the victims and help create a healthy environment conducive to their health and improvement. Oh my god, dude.
Oh my god.
You weren't actually supposed to.